Hey guys, before the episode actually starts, I just wanted to call something out. The third question in this Q&A talks about panic attacks. As a part of my response, I talk about having a meltdown on the floor of a grocery store, and I assert, so what? The worst that will happen is you'll be embarrassed, and that's not so bad, considering everything in the world. Thinking about the episode afterwards, though, later in the day, I realized how much unconscious white privilege I was displaying when I said that. While it might be a so what kind of moment for me, a middle-aged, middle-income, cisgendered white woman, the consequences for others, people of color, trans and visibly queer folks, immigrants, etc., could be far more grave. I just wanted to take a moment to acknowledge that and to apologize for being blind to my privilege in the moment of the actual recording. Thanks so much for giving me a moment of your time, and I hope you all enjoy the episode.
Dialectical behavior therapy was created in the 1980s by Marsha Linehan in Seattle, Washington.
Today, DBT is taught all over the world.
We're two therapists who believe everyone can benefit from DBT skills.
I'm Kate.
I'm Michelle.
And this is DBT and Me.
Hello, everybody.
Hello, everyone.
And we are here for Q&A 73. And I can't think of anything that interesting about the number 73 except 73. It happens to be my favorite number.
Also,
I like the number 7 and 3. It has to be my favorite number.
Obviously, it's my favorite number 7 and 3. It has to be.
It has to be, yes. So this is a good number in my book for a Q&A. And Kate, you're going to kick it off today with the first one.
This one reads, although it's not strictly DBT related, and I don't know if it has already been spoken about before, but I think it would be cool for you guys to talk about accountability, apologies, restorative practices, restorative justice, etc. I had really unhealthy boundaries and an unstable sense of self, which not only put me in a position to get hurt repetitively by people, but I have also acted in ways that have severely damaged relationships and my reputation. Although it was not my intention to cause harm, and I was functioning to the best of my ability at the time, it's still something that really bothers me as my past behaviors do not align with my present values. One thing I find particularly hard is dealing with the guilt and remorse for my behaviors with people I no longer have a relationship with and that I don't necessarily want to try and fix and restart a relationship with. Sometimes I think about reaching out to these people and apologizing, but I feel like it's more for my benefit than for theirs. If I was in their shoes, I wouldn't want/care to hear from someone who hurt me and who I have emotionally moved on from years ago. If anyone has thoughts, I'd be happy to hear them.
I really appreciate this listener's self-awareness. Like to be able to name and take accountability for the fact that they have severely damaged some relationships in their lives, to also be able to put themselves in the other person's shoes and go, I imagine how it could feel for them to hear from me, and it might feel really uncomfortable. So I don't want them to feel uncomfortable. And that's been something that I've considered is their perspective when I've thought about reaching out. I mean, that all shows a lot of growth and a lot of insight. So I want to start there. What really, this listener is talking about is the concept of making amends, and even though I'm not super familiar with the ins and outs of it, I know that making amends is one of the 12 steps in, 12-step programs, right? Like Alcoholics Anonymous. It's really important for someone's recovery when they're transitioning from active addiction to sobriety, to take that accountability for the harm they have caused when they were using. That's really important. And I hear this listener wanting to do that, right? They want to take that accountability. They want to try to make things better if possible. But I really want to speak to the scenario this listener is bringing up, which is how do you do that? Do you do that at all with people that you don't have a relationship with any longer? And what does that look like to consider reaching out of the blue and that kind of a thing? I would say this is a good starting point, maybe, because the listener was able to recognize that it could potentially be harmful or difficult for these people to hear from them. I would say for the listener that, like, if you ever just think about these people that you've harmed, if they pass through your mind and one day you're thinking out of the blue about like, oh man, I remember what I did 3 years ago to so-and-so, doesn't mean you have to then pull out your phone and go through your contacts and call so-and-so and say, hey, I was thinking about you. I'm really sorry for what I did. Doesn't have to look that way. Where I would start is when you're thinking about them, and I know this is kind of woo-woo what I'm about to say, but like think good thoughts in their direction. It could just be as simple as saying, I don't know, let's say you harmed someone named Jane. Jane, I'm thinking about you. I hope that you are doing well in your life. I hope that you are experiencing peace and happiness in your day-to-day. And just like take a deep breath and just think about that.
Like a little mini loving kindness meditation.
A little bit, yeah. Yeah, that's true. It is a little bit of loving kindness, right? Like just thinking that. And the other best thing that you can do, rather than, we could say, rewinding to these people and these events where harm has already happened and trying to fix what's gone on in your past, is just to really think too about like, what have you learned from these past experiences that now informs how you move through the world into the future? How do you make different choices now with the people that are in your current life? And when you can connect those dots, where again, maybe a thing where it's like, well, even though I didn't make amends with Jane for that thing that happened 3 years ago, but last week I was in a similar situation with someone else. And instead of yelling at them like I yelled at Jane, I actually responded really differently to them. Great, fantastic. You are making a positive impact in the world and the people in your life by making different choices now moving forward. And to me, that matters more than anything. What about you, Kate?
I think we had a lot of similar, not same, but similar vibes. I think it's
lots of like, kudos, listener. You're doing great.
Right. Like all through it, actually. I think very similar vibe check, even if it's different technical thoughts. Because the first thing I thought of was just how beautiful and awesome and admirable the dialectical thinking was in the message from this listener. It's so rare for someone to be able to both see the harm done to them and also maintain being grounded in realizing and taking responsibility for the harms that they've done to others. Like, that's really, 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 really tough. So, like, hats off, right? Well done, you, listener. One of the things that stood out to me was how to handle the guilt that this person was talking about feeling in ways that weren't like, okay, I know it'd probably help my guilt to reach out, but I don't want to do that just for myself. So how do I take care of myself here? My first suggestion was to make some intentional time for the guilt, and including also maybe the grief that I suspect is entangled with that guilt. And then try some different things to try and gently lay it to rest. So some of those things that might look like writing letters and burying them or burning them or, I don't know, planting a plant, like things that you could find for grief rituals, right? If you were looking online, you might look up grief rituals as ways to sort of let go of ideas. But I do conform an English sentence. I think that guilt, because it's so unpleasant to feel, is something that we quite naturally tend towards avoiding. and not spending time with, but most emotions need their time in the limelight, right? They need and deserve that attention. And so that's why I suggest sort of leaning in to feeling and experiencing the guilt, even if it's unpleasant. Also, because guilt is, I would say, an emotion that motivates us to do or to do something different, which I think really keys into what you were talking about at the end of your share there, Michelle. It's like the world has become a tongue twister all of a sudden to me. I don't know what's going on. Anyway, right, like that's what guilt is meant to make us do, right? Is do things at all and or do things differently, right? So everything that Michelle was said. See, what is happening here? Everything that Michelle said, or everything that Michelle was saying, I'll pick one of the two sentences, Kate. Anyway, oh my goodness. Some other things I thought might help the listener move on is, even if other people don't know about what you're doing in the slightest, it might help to do something meaningful to honor the person that you harmed. One thought I had was, for instance, like donating to a cause or a charity that they would care about. Maybe in their name, maybe not, but just doing something to make the world better in a way that you suspect aligns with their values, which I think, again, is very similar in vibes to what Michelle was saying about just moving through the world differently. But yeah, being deliberate about that and recognizing that you can trace it back to things you've learned there, like Michelle was saying, are going to really help. So, see, similar vibes check. Different ideas, but similar vibes.
Yeah, definitely. Okay, the next one reads, for any of my fellow bipolar folks, does your mania get super triggered by yoga or exercise, and specifically somatic hip release? I've been on a mindfulness and body integration journey recently after being in a dissociative survival state for years, and I've been diving deep into exercise and somatic yoga practices to release trauma and tension and get me feeling more present in my body. But I've run into an obstacle, and I'm wondering if anyone has experienced anything similar. After doing my research, there does seem to be a documented link between high-intensity cardio and specifically hot yoga and mania, but I can't find anything on somatic trauma release and aggravated bipolar symptoms. I've been really enjoying working out and how my body has been feeling after starting to pick up this habit more regularly, but I can't deny that after a few weeks of sticking to it, the manic symptoms I've been experiencing are unrelated. It didn't get out of control until last night after my first hot yoga class. I proceeded to not get a lick of sleep the entire night because I was so wired from the workout. I don't want to give up on exercise. Thanks for listening.
Yeah, I think a couple of disclaimers that feel important to me are just to say that I am not a fellow bipolar folk. And I do want to acknowledge that anything I have experientially here is experienced from interacting with other people who have described being in these places. But I don't have lived experience of what mania is or feels like in my body. So I did want to acknowledge that. Yeah, I know that the listener was mentioning having found a tie between certain forms of exercise and mania. I certainly know that anxiety can get triggered by exercise, because when your body is in that excited state that exercise puts it in, your body can be like, hey, this feels an awful lot like anxiety. And so I can imagine that also being a place or a way that your body might connect to a sense of mania also. That being said, I have not found specific things myself around the what did they say? The somatic hip release, and those other procedures. But also, I'm a big proponent of, your body, right? Like, I don't know. I don't feel like I personally have any reason not to believe the listener if they just say like, yo, I've noticed that when I do this stuff, my mania increases. Like, I don't doubt the listener, I don't think. And I would love that person to feel okay trusting themselves, even if they can't immediately find not necessarily, how do I put it? Not like, in the face of all other information, I shall still believe this. But also, sometimes people haven't looked into things, and it doesn't mean that the thing isn't real. So I think giving enough credence to yourself to take it seriously, to try and maybe make adjustments, makes a lot of sense, even without maybe documented things to be able to point to about it. First thought is just potentially talking to your therapist or med provider if you have either of those, because they might be able to tailor ideas more specifically to you. and the things they know better about your past, etc. Michelle and I are always saying how we only get this tiny little slice of a person in these little questions that we get. So they may have more information about you that helps answer the question better. But the ideas that I had at first were to potentially try doing some body-based mindfulness before and after the exercise. So really trying to ground yourself in the state your body was in before going into the exercise and see if you can sort of re-find that space on the other side of the exercise. Possibly doing some pretty significant opposite action. So leaning in hard to resting, to deliberately moving slowly, to laying down, etc. After having a workout to help calm down your body and your physiological responses. Also thought that maybe, since this person was really saying that they don't want to give up exercise, but didn't specifically say that they were that attached to the specific forms they were talking about, that possibly it could just be a matter of finding different forms of exercise that still look like what this person is hoping to get from exercise, but without producing those same results. Possibly things like slow weightlifting, right? Like doing things that are more slow and methodical and deliberate as a way to being exercise, as opposed to things that are quick paced and burst energy and things that are really likely to get your body pretty amped up. So those were my long-winded ideas.
Mm-hmm. No, I think your ideas are great. And when I first came across this listener's question, it's so niche and it's really specific. And like you said in the disclaimer, Kate, we are not medical professionals. It was, it's been a number of years since I worked with a client who was diagnosed with bipolar disorder. And I was like, do I recall any of my clients that I've worked with this diagnosis reporting similar things? And I couldn't remember. I do think, though, when this listener posted it in the Facebook group, they did get some people commenting back being like, yes,
good.
That has happened to me. I do think there was like some agreement with that. But I got curious. And so I was like, what research or information is out there if I did a Google search about the connection between bipolar disorder and exercise? And I found this article. I'm just going to really summarize the key main points here. But there's a doctor quoted in the article. His name is Jim Cummins. He's a psychiatrist. He said in the article, for an individual with bipolar disorder, the mood regulating circuits in the brain can be super sensitive to conditions and substances that affect mood, including exercise. So there is kind of this predisposed sensitivity maybe to things, like hot yoga or more extreme workouts. And the article says, that what can happen is that when somebody especially is in a manic episode, even if it's just barely starting, then going and working out can just accelerate it more or less if you're already on the cusp of it or just starting, because some of that can play into the grandiose thinking that can accompany mania, right? You may normally, only work out for 30 minutes, but if you're in the midst of mania, you may be like, I can work out for 2 hours and it'll be fine, or that kind of a thing. So there can be that relationship there. And one of the things it did specifically say is that, there can be certain types of exercise. It did really mention hot yoga. That was one that the article mentioned of that specifically if you're changing up your workout routine and you're doing something, that is high cardio or, hot yoga. It said something when there's rapid energetic breathing involved in the type of exercise that you're doing, which could be present in hot yoga because, you're sweating a lot more, you're kind of panting. It definitely said that can intensify mania. One of the things the article recommended, again, we're not doctors. Take it with a grain of salt. Check it out with your own doctor. See if it's something you want to
please.
try and that works for you. It was talking about how swimming could be a really good form of exercise for somebody with bipolar disorder, because being in the water can be really grounding.
It also paces your breathing for you kind of naturally, depending. So that's nice. It's like singing does that for me. Singing helps me have paced breathing.
Yeah. And in general, it was like, what's really important for somebody with a bipolar diagnosis and exercise is that you want to have a consistent exercise routine that you keep really the same.
Oh,
like I think sometimes for some people with exercise, like, I don't know, if let's say weightlifting is your thing, your goal may be, I want to be able to lift more. Like, I want to intensify this. That's, I would say, a very natural goal that anybody would have with working out. Or like, let's say you run on the treadmill. I want to run on a faster pace. I want to run for longer. Whatever it is, we set these like goals for ourselves. And the article was saying too that if you do have a bipolar diagnosis, no, keep it the same. If you walk on the treadmill for 30 minutes at a certain speed, just do that pretty much always. Like, because you do run the risk of once you start intensifying your workout, then it is possible to experience what this listener was writing in about, that like the media just, can really take off. So whatever you're doing for exercise that feels like it's working for you, try to keep it very consistent and not mix it up too much, because it could become problematic. So I thought that was really interesting to read that stuff, that article.
Thank you for sharing. Probably put the link in the show notes or something.
Yeah, I think I will. That's a good idea.
All right. My next one reads, "Hey everyone, I've been doing DBT in therapy and struggling with panic attacks. I also freak out about the next panic attack and feel like I'm unable to cope. I struggle to leave my house at times with past traumas. I cannot email my therapist and only see them once a week. I'm not sure how else to manage. Any advice?"
Yeah. This is actually one of the criteria for panic disorder. It's not just that you experience the panic attacks themselves, but there is this worry about when is the next one going to strike.
Yep,
that
a
can be
meta
really persistent
experience.
worry. Yeah, it can, for some people, really keep them up at night, make them scared to go out because they're like, last time I went there, I had a panic attack. I'm worried if I go there again, I'm going to have a panic attack. So super common, what this listener is describing. So what I would recommend is really this principle that I think we talk about a lot with DBT, which is that skills will only really be helpful for you if you have practiced them before you need them. This is really true with panic attacks. Once you're in it, your brain is going to have a super hard time remembering skills, especially to think of something that you're like, I've never done this before, but my therapist told me to try this. Okay, I'll try it for the first time now when I'm in the panic attack. Nope. Do it beforehand. Try it out. See what works for you. The number one skill that I feel like we tend to recommend for panic attacks is definitely tip. And tip can be, I think of it as like a little bit of like a portable skill. You can pretty much do those things without needing a whole lot of pre-planning. There's some skills like, say, self-soothing. This is why we talk about self-soothing kits. You need things available to you to do that. But tip, like one of the P's stands for paced breathing. You always have your breath. And we've talked pretty extensively about how with temperature, as long as you can access cold water somewhere, like even if it's in a public bathroom to splash some cold water on your face, you can make do with that too. But you want to play around with that stuff at home beforehand and get comfortable with what that skill looks like for you. So then you know what it's going to look like when you really need it. Cope Ahead is also super helpful. Cope Ahead is all about visualization, right? Like imagining yourself having a panic attack and what you would do to get through it. Like really envisioning yourself, I'm going to throw in another DBT term, riding the wave of the panic attack all the way through and what that looks like for you. So definitely doing some Cope Ahead would also be very, very helpful, I hope. The last thing I'll say that I think can just be, a good mantra to remember. And Kate, I feel like you've spoken to this on past episodes really well with like your own lived experience.
Yeah.
Because you have been in the trenches.
With anxiety. It's true.
With anxiety, like huge emotions. I mean,
Yeah.
You've said that you've cried so hard you've thrown up. Like,
oh, and I've been so anxious I was incontinent. I had to wear panty liners in my underwear because I was occasionally slightly urinarily incontinent because I was so fucking anxious. Yep.
Yeah.
So anxious I was literally pissing myself. Yep.
Yeah. And like, yet here you are. You have come through those experiences.
Mm-hmm.
And it doesn't mean that, you won't at some point in the future. I'm sure you will, right? Like it's inevitable that it'll strike again probably at some point. Like there will be a time where where the emotion is so overwhelming and so big. And that's the thing to think about here, unfortunately, listener, right? You're probably going to have another panic attack again. It's probably going to happen. But to remind yourself that every panic attack you've had up until this point, you've survived it. You've gotten through it. You've gotten through the really horrible, awful feelings that you were experiencing in that moment, and you've gotten to the other side. And so any panic attacks that you may face in the future, you will also be able to survive those. Yeah. Even if it sucks horribly when you are in it, you will get to the other side. And that can be sometimes helpful to remind yourself too, just at baseline. I think especially if you find yourself, say, avoiding going out. Well, and they even said this. They said they're struggling to leave their house at times.
Yep.
So maybe before you leave the house to go somewhere, to just remind yourself, like, whatever emotions I experience when I'm here, even if, I don't know, you're in the grocery store and you find yourself in the middle of an aisle, like curled into the fetal position, like racking sobs, like losing your shit, you will still survive it.
Ooh, I once had such a big emotional breakdown that caused the cops to get called to my apartment.
Yeah.
Also lived through that one.
That
was probably the pinnacle for me of like social embarrassment vis-a-vis my own emotional outbursts. That was the top of that particular mountain. And here I be.
Mm-hmm. And here you be. Right, exactly. Like, so if that is at all helpful to tell yourself that of like, this sucks, but I can survive it when it happens, then that could be something helpful to think to yourself. But I'm really curious to hear your thoughts on this one, Kate.
You and I are so fucking vibes matched today. It's ridiculous. Because a lot of it, that's why I was nodding along with a lot of what you're saying, because a lot of what I'm going to talk back to harkens back to my experience with this shit too. To be fair to this person, I've have panic attacks, but it's in the case more of generalized anxiety disorder, because I never really got that, oh God, what about the next one? Like that piece wasn't or isn't
and
a
that
piece
is one of the criteria for panic disorder.
Yeah. But still, I think lots of anxiety to help to speak from. The very first thing I thought was that this is a great place to get comfy with checking the facts, right? Anxiety is the great liar, right? Like panic is very sure of itself, right? But that doesn't mean it's right. Right. So I'm a weirdo as far as I can tell. I know I'm not the only person, but far more people that I know, thoughts are a piece of their anxiety, their panic attacks, etc. That there's some sort of maybe specific singular thought that's getting ruminated on, or maybe like a lot of different thoughts, like, oh, I'm overwhelmed by all these worries. But that there's a lot of thought-based stuff to most people's anxiety. If that's the case, highly, highly recommend, again, as Michelle was talking about, practicing when you're not in a panic attack, but getting really comfy with checking the facts, right? about the thoughts that the anxiety is throwing at you, and maybe even with how you're prone or desire to define or think about the panic attack. How do I want to mean by this? What do I want to say by this? Essentially, let's see, the first time I got a panic attack, I will say I'm incredibly grateful that I got it after I was in grad school. Because I remember thinking to myself, this is why people think they're dying, right? Like I remember very clearly having that moment of experience of going like, oh, okay, I get it now. Yep, this could feel like dying. I'm with them, right? And also if we buy into that, then that ramps the panic higher, right? And sort of keeps us entrenched. And so doing whatever you can to help keep yourself grounded in reality. If you're a brainy, panicky person, that's more thought-based, things like check the facts. Michelle talking about cope ahead, that would, I think, also count here. I was going to also suggest effective rethinking and peri-relaxation, right? These are all things that can help shift your thinking before a panic attack, about a panic attack, and including during a panic attack, right? So if you're very thought-based, I think there's some great skills there. For myself, I am almost 100% free of thoughts around my anxiety. I'm like, I'm so anxious today. Why is that, Kate? And my answer is always, I have no fucking idea. Because I don't have any anxious like thoughts or interpretations going on. I just have it in my body. But boy, fucking howdy, does it like to show up in my body. Blah. So it is so important again to stay grounded in the reality that this is only a panic attack, right? Nothing is actually wrong with me, and this will eventually pass, right? Like that's sort of my way of saying what Michelle was talking about of I've survived everyone up until this point, right? Is that regrounding yourself in what a panic attack is and isn't, because what it is just a panic attack. It's an emotional experience, right? It is a series of electrical and neurochemical and hormonal cascades in your body doing a thing, right? It's nothing more and nothing less than that. So that's not going to make it go away entirely. I have yet to be able to be this is only a panic attack, my way out of having a panic attack. Like it doesn't just make it go poof. But it does significantly help to reduce just how intense my panic attacks are. Some of the other ways that I've learned to see it is like it's the emotional equivalent of, say, tolerating tattoo pain, or if there's anything else you do that you tolerate pain for, if you run a lot, or if you, I don't know, if you engage in anything where you tolerate pain. For tattoos, I've often told myself and my body, like, yeah, body, I know it hurts, but this is just pain. This isn't injury, right? Like, I'm getting the message, right? And that's the same thing for my body. I'm like, my body is experiencing a tremendous amount of fear right now, right? Like I'm getting the memo. I hear you. You're just not right, right? You're trying really hard to pass on incorrect information, anxiety. So yeah, you can survive it, I would say, much more well than you think, but a lot of that is based on how well you think you can, right? It's a little bit of a whether you think you can or you think you can't, you're absolutely right. Actually goes pretty strongly into this. The other thing I would suggest, and one of the reasons that I would say that least wants to do the actual entire checking the facts worksheet, not my favorite thing in the world. I like the shortcut really well, but there's a really good reason sometimes to do the whole sheet. And I would say the part that talks about what is the catastrophe and what would you do then is super important. Like Michelle was talking about, maybe you end up curled in the fetal position in the grocery store weeping. I'm not saying that's going to be anyone's favorite Saturday, right? Like, I'm not even going to say that will turn into a funny story later, right? Like, this could just be shit, just abject crap, just in one side and out the other, right? Like, bleh. And also, in the most loving, gentle, mindful way possible, so what? Mm-hmm. So what? You were embarrassed. It was awful. It was gross. It was nasty. It was no good, very bad. I wouldn't wish that on almost anybody. I'm not quite a good enough person to say on nobody. But right, but it's not it's not damage. You're not injured, right? It's like the tattoo. It's pain, but it's not injury. Having a total meltdown in public, I can speak from experience, is painful, but not injurious, right? It's embarrassing, and it's, I don't know, my mouth is making the disgust face. So some version of disgust is going on for me about it. So again, not trying to entirely undermine the severity of that experience, but also trying to take a higher level view of that severity of like, put it within having a human life, right? This was a moment of extreme embarrassment. Yep. No more, no less.
Yeah.
Right?
Yep.
And that can take you far. I mean, it's not my favorite thing to do, but honestly, on almost every week at some point, it happens to intersect that I end up doing work. Like, so sitting with a client while I'm having a panic attack. Because my body does that thing with a regularity. And I've been able to make it so I can even work through them because I can just acknowledge that my body is experiencing tremendous fear. Like, give it that gentle recognition, like, oh boy, hello. You are experiencing a lot of fear right now. Right? Like, and doing a sort of a self-compassion break. I don't know if we've referenced those here somewhere sometime.
Oh, yeah. Yeah.
Okay.
This is a moment of suffering.
Yeah. So doing essentially something very like that sort of self-compassion moment, and then just being able to move forward while my body does what it needs to do to work its way through that fear. And I can know that my body is doing what it needs to do and not take more meaning from it than it actually holds. So yeah, I'm trying to see. I'm like, is there anything else that I said in my notes? Nope, I think that's what I want to say about that.
Awesome stuff. All right, last one. This one says, as a therapist focused in DBT, I still sometimes get stumped by client questions. So I thought this would be a great place to ask. Does DBT make any distinction between feelings and emotions, or are they used interchangeably?
All right, so quick plug for the revised editions of the DBT handouts, etc., where you can get from Guilford Press with our affiliate code. Look at me slipping that in there all natural like.
Nice.
Which is DBT Me at checkout. There you go. But I did actually go through because I was like, all right, I have a crap answer to this from when I first got it, which was, I don't know, I haven't checked yet. But I checked this time. And I can say that the word feeling or feelings does not show up in any of the handouts or the worksheets at all. It's just not there as a topic. It's not in the index. We do not talk about that thing, apparently, in that book. So I don't think the DBT does. I do not think the sacred texts. What's that called? What are, like, not the Bible. I mean, Bible is a sacred text, but there's a word I want. My brain's not giving it to me, and
that means sacred text?
Yes, whatever. Know. Anyway, the sacred text of DBT, I don't think actually define a difference there. You might be able to find things that are associated with DBT that someone somewhere has decided that this was an important question to answer and made up an answer for it, which is what I do when I'm asked this question. And the answer I make up is what Michelle's about to say. So I'll leave that one to her. But I do think I can say they do not distinguish between those in the handouts, like in the... Not the Testament. Why? Okay, you talk, and I have to go Google synonym, or I'm going to die.
All right, just chime in once you find the word you're looking for. Yeah, echoing a little bit of what Kate is saying. Off the top of my head, I really think the phrasing that I have seen...
Scripture!
Scripture?
Yes.
Is that what you said? Yeah, yep. Perfect. In, the DBT manual and things like that is the use of the word emotions. That's what I have seen far more than use of the word feelings. I don't know exactly what the reason for that is, but my guess could be that because we can feel a lot of things that are not emotions, right? We can feel hungry. We can feel tired. We can feel pain. We can feel all kinds of things. But, I think DBT wants to be really clear that when we're talking about feelings, we're truly talking about like, yeah, what emotional state are you in? Are you in, and we can boil it down to the core emotions, right? Anger, fear, sadness, disgust, and joy. DBT, I think, actually DBT really, I think, talks about like 10 emotions.
I know, like jealousy and envy are in there separately, which is probably the best way that DBT wins my heart.
Yes, it has those in there separately. It has love as an emotion. So yeah, I think it's about 10 emotion words that you'll see come up over and over again within the DBT text, especially in the context of talking about what is the opposite action.
When does it fit the facts and what is the opposite action to it? Yeah.
Yep. Yeah, exactly. So I would say if, because this person mentioned they're a therapist and, this client is wondering, what's the difference between feelings and emotions? I mean, to some degree, tomato, just depends on how you're using the
feelings
term.
Is anything you feel in your body.
Yeah. But I think DBT really, really leans on the phrasing of emotions rather than feelings.
Truth.
That's what I would say.
All right.
Okay.
All done?
Yes.
Excellent.
You get to wrap us up. I almost went into wrapping us up and then I was like, oh, wait, no, that's good.
All right. Well, that was wonderful. I'm so sad now to be past your favorite number, but we're closing in on one of mine, so that's nice, I suppose, to look forward to in the future.
Ooh, are you going to tell us what it is now, or do we have to wait and find out?
You have to wait and find out.
Okay.
But if you want to be heard, your question in a future Q&A, which we're working on catching up, we are. But also, you guys get the answers faster. This is just where you get to hear it on air. Go ahead and send us emails at dbtandmepodcast@gmail.com and or post on the Facebook group. That's where a lot of these come from. So fantastic. And we'll talk to you in the next one.
Yep. All right. Thanks, everybody.
To learn more about us and the DBT skills we're teaching each week, join our Facebook group. Simply log in to your Facebook profile and search for DBT and Me Podcast.